Imagine you're sitting at your kitchen table, reaching for that small white pill you've been taking for years. You take it for your back pain, your stiff knees, or maybe just to manage those nagging aches that seem to come with being over 60. You've been told it's safe, it's standard, and millions of people take it every day. But what if I told you that as a cardiac surgeon, I see the hidden price of that harmless pill every time I open a chest in the operating room? What if that specific medication, while quieting your joint pain, is actually acting like a silent saboteur inside your chest, weakening your heart muscle and stiffening your arteries until they can no longer do their job? Today, we are pulling back the curtain on a class of drugs that are remarkably common but potentially devastating for the hearts of older adults. We aren't talking about rare, experimental chemicals. We are talking about medications sitting in your cabinet right now. I'm going to show you why your body at 65 processes these drugs differently than it did at 35, how they trigger a cascade of events leading to heart failure, and exactly what you should be asking your doctor to protect your most vital organ. Let's get straight to the truth that the pharmaceutical commercials often leave out. The group of medications I'm talking about are known as NSAIDs, or non-steroidal anti-inflammatory drugs. You likely know them by their household names like ibuprofen, naproxen, or diclofenac. For a younger person, an occasional dose for a twisted ankle isn't usually a cause for alarm. But for older adults, the chemistry of the body has changed. Your kidneys don't clear these substances as quickly as they once did. Your heart tissue has become more sensitive. When you take these drugs regularly for chronic arthritis or long-term pain, you aren't just treating inflammation in your joints. You are initiating a biochemical reaction that forces your heart to work much harder against much more resistance. As a surgeon, I see the end result of this process. I see patients who come in for a routine bypass or valve repair, and their tissue looks different. Their blood pressure is harder to control. Why? Because NSAIDs work by blocking certain enzymes called COX enzymes. These enzymes are responsible for pain and inflammation, yes, but they also have a second, vital job. They produce substances that keep your blood vessels open and relaxed. When you block these enzymes, your blood vessels constrict. For a heart that has already been beating for 6 or 7 decades, this sudden increase in pressure is like trying to pump thick honey through a thin straw. Your heart muscle has to push with more force, which eventually leads to a thickening of the heart wall, a condition we call hypertrophy. Over time, that thick wall becomes stiff, and a stiff heart is a heart that is headed toward failure. The most insidious part of this is that the symptoms are often dismissed as just getting older. You might notice you're a little more winded when walking up the stairs. You might see that your socks are leaving deeper indentations around your ankles at the end of the day. You might feel a bit more tired than usual. Most people think, well, I'm 70, I'm supposed to slow down. But often, those aren't signs of age, they are signs of fluid retention and increased cardiac load caused by your pain medication. These drugs tell your kidneys to hold on to salt and water. This increases the total volume of blood in your system. Imagine your circulatory system is a balloon. If you keep pumping more and more water into it without letting any out, the pressure rises until the material starts to stretch and weaken. That is exactly what is happening to your heart and your veins. Now let's talk about the specific danger of heart rhythm. Many older adults already struggle with a condition called atrial fibrillation, or AFib, where the top chambers of the heart quiver instead of beating steadily. Research has shown that regular use of NSAIDs can significantly increase the risk of developing these rhythm problems. When the heart's electrical system is bathed in the chemical environment created by these drugs, the signals can get crossed. A heart out of rhythm is a heart that isn't pumping efficiently, and it increases the risk of other serious cardiovascular events. As a surgeon, a stable heart rhythm is my best friend in the recovery room. Anything that disrupts that rhythm makes a patient's journey so much more difficult. I want to share a story with you from my practice, though of course I'll keep the details private. I had a patient, a very active 72-year-old man who loved gardening and walking his dog. He had some chronic hip pain and had been taking a high-dose over-the-counter NSAID twice a day for nearly 3 years. He came to see me because he was suddenly struggling to catch his breath. When we did the ultrasound of his heart, we found that his heart's pumping capacity had dropped by nearly 40%. He didn't have blocked arteries. He had a heart that had been overworked by constant high blood pressure and fluid retention, all triggered by his safe pain relief. The tragedy is that he thought he was doing the right thing for his health by staying active, but the tool he used to stay active was the very thing stealing his stamina. So why are these drugs so widely recommended if they have these risks? It's a matter of the divided doctor. Often, your orthopedist is looking at your joints. Your primary care doctor is looking at your general well-being, but the cardiologist is the only one looking at the pump. In our modern medical system, specialists often don't talk to each other enough. The doctor treating your knee pain might not realize that your heart is already struggling to maintain a healthy pressure. This is why you must be your own advocate. You need to ask the heart question every time you are given a new prescription. Ask, "Doctor, how will this affect my cardiac output and my blood pressure over the long term?" The chemical burden on the kidneys is another factor we cannot ignore. The kidneys and the heart are like two best friends. When one is stressed, the other feels it immediately. NSAIDs reduce the blood flow to the kidneys. When the kidneys feel that reduction, they send out a hormonal signal to the body to raise blood pressure to compensate. It's a vicious cycle. The drug makes the kidneys struggle, the kidneys make the heart push harder, and the heart eventually begins to wear out under the pressure. In older adults, kidney function naturally declines, meaning the window of safety for these medications is much smaller than it is for a 30-year-old. What should you do if you have chronic pain? I am not telling you that you must suffer in silence. Chronic pain itself is a stressor on the heart because it keeps your fight or flight system activated, but we need to move toward heart-friendly pain management. There are local treatments, like rubs or patches, that deliver the medication directly to the joint with very little of it ever reaching your bloodstream or your heart. There are physical therapies and low-impact exercises like swimming that can reduce inflammation naturally. And there are other classes of pain relief that don't have the same harsh effects on the cardiovascular system. I want you to take a moment and look at the labels in your medicine cabinet today. If you see words like ibuprofen, naproxen, or diclofenac, and you are taking them every day, you need to have a serious conversation with your healthcare provider. Even the natural-looking versions or the extra-strength varieties are built on the same chemical foundation. We have been conditioned by decades of advertising to think of these as comfort drugs, but as a surgeon, I see them as consequence drugs. The comfort they provide today can lead to a very difficult tomorrow for your cardiovascular health. Let's dive deeper into the chemistry of the heart wall. Your heart is a muscle, and like any muscle, if you give it a heavy workout every single day without rest, it grows. But unlike your biceps, a larger heart is a bad thing. When the heart wall thickens to fight against the high pressure caused by NSAIDs, it leaves less room inside the chambers for blood. This means the heart has to beat faster to move the same amount of oxygen around your body. A heart that is constantly racing is a heart that is fatiguing. When I look at an ultrasound of a patient who has been on these medications for a long time, the heart often looks stiff. It doesn't have that beautiful, bouncy, elastic quality of a healthy pump. It looks like it's struggling with every beat. Furthermore, we must consider the risk of internal bleeding. While this video is focused on the heart, the vascular system is one connected web. NSAIDs thin the lining of the stomach and can interfere with platelet function, which is how your blood clots. For older adults who might already be on a baby aspirin or a blood thinner for their heart, adding an NSAID is like pouring gasoline on a fire. The risk of a major gastrointestinal event increases exponentially. These events put an enormous strain on the heart, as it has to pump faster to compensate for any internal volume loss. It is a domino effect where one pill can knock over the entire system. You might be wondering about aspirin. Isn't that an NSAID? Yes, it is, but it's a bit of an outlier. In low doses, aspirin is often used to prevent clotting. However, even low-dose aspirin should be discussed with your doctor, as the newest guidelines have changed regarding who should be taking it daily. The blanket advice of everyone over 50 should take an aspirin is no longer the standard. For many, the risk to the stomach and the potential for internal issues outweighs the benefits for the heart. It's all about a balanced, personalized approach. There is no such thing as a one-size-fits-all pill when it comes to the human heart. As we age, our bodies become more like a classic car. A classic car can still run beautifully, maybe even better than a new one if it's well maintained, but you can't just put any fuel in it. You have to be careful with the additives. You have to check the fluids more often. Taking a high-dose anti-inflammatory every day is like putting low-grade, abrasive fuel into a vintage Ferrari. It might get you down the road today, but it's doing damage to the fuel lines and the engine block that you'll regret in 5 years. We want your heart to last for 90, 100 years. To do that, we have to protect the plumbing and the electricity from chemical interference. I often tell my patients to think about their total chemical load. Between blood pressure meds, cholesterol pills, and whatever else might be prescribed, Your liver and kidneys are already working overtime. Adding a daily NSAID can be the tipping point where the body can no longer keep up with the detoxification. When toxins or drug byproducts linger in your system, they can cause systemic inflammation, the very thing you were trying to fix in the first place. It's one of the great ironies of medicine. By trying to stop the inflammation in your knee, you might be causing a low-grade inflammation in your entire vascular system. Let's talk about the water weight trap. Many people over 60 notice their rings getting tighter or their shoes feeling snug. They think it's just weight gain or too much salt in their diet. While those can be factors, one of the most common causes of sudden fluid retention in seniors is the use of NSAIDs. When your heart has to pump against that extra fluid, the pressure inside the atria, the top chambers, rises. This stretching of the atria is the primary trigger for AFib. If you can eliminate the drug and shed that extra chemical water weight, you might find that your heart rhythm stabilizes and your energy levels soar. It's like taking a heavy backpack off after a long hike. One thing I want to emphasize is that the damage isn't always permanent if you catch it early. The heart has a remarkable ability to remodel itself if the stressor is removed. I've seen patients whose heart function improved significantly just by switching their pain management strategy. They went from being heart failure candidates to healthy, active seniors again. But this requires courage. It requires the courage to stop a habit that feels like it's helping your pain and to look for deeper, more sustainable solutions. What are the alternatives? If you are struggling with arthritis, talk to your doctor about acetaminophen, which doesn't have the same effect on blood pressure and blood vessels, though it has its own limits regarding the liver. Look into anti-inflammatory diets rich in omega-3 fatty acids, turmeric, and ginger. These aren't just health food trends. They are biochemically active substances that can help lower systemic inflammation without the hammer effect of a pharmaceutical NSAID. Consider acupuncture, water aerobics, or even gentle yoga. These methods manage pain by improving blood flow and flexibility, which actually helps the heart rather than hurting it. For my patients who are about to undergo surgery, I always have them stop these medications at least a week before. We want the kidneys at full strength and the blood's natural ability to heal to be at its peak. If you have an upcoming procedure, whether it's for your heart or something else, be very transparent about your pain med use. It can change the way we manage your anesthesia and your recovery. A heart that isn't under the influence of NSAIDs is a heart that recovers much more predictably. I want you to become an informed patient. Don't just take a pill because it's there. Read the fine print on the back of the bottle. You'll see a warning about cardiovascular risk right there in the tiny text. Most people ignore it because they think, that won't happen to me. But as a surgeon, I'm telling you, it happens to someone every single day. The risk is real and it's cumulative. The more years you take it, the more deposits you are making into a very dangerous account. We also need to talk about the silent stroke. Sometimes, the high blood pressure caused by these drugs doesn't lead to a heart attack, but to tiny, microscopic events in the brain. Over time, these can lead to cognitive decline or what people call senior moments. By protecting your heart and keeping your blood pressure stable, you are also protecting your brain. The vascular system is a giant highway, and the heart is the central station. If the station is struggling, the remote outposts in the brain will eventually lose their supply of oxygen and nutrients. I'm often asked, Dr. Wagner, is a single pill once a month okay? Generally, for most people the answer is yes. It's the chronic, daily, or near-daily use that creates the surgeon's nightmare. It's the reliance on these pills as a crutch for daily life. We need to stop viewing pain as an enemy to be silenced and start viewing it as a signal to be understood. If your joints hurt, your body is telling you something about your movement, your weight, or your nutrition. Trying to silence that signal with a drug that damages your heart is like cutting the wire to a smoke detector because the alarm is too loud. The fire is still burning. You've just made it impossible to hear the warning. Being over 60 is a wonderful time of life. You have the wisdom, the experience, and hopefully the time to enjoy what you've built. Don't let that time be cut short or diminished by a preventable heart condition. Your heart has already beaten billions of times. It has carried you through every joy and every sorrow of your life. It is the most loyal companion you will ever have. It deserves to be treated with respect, not drenched in chemicals that make its job harder. I want to challenge you to a heart-safe week. For 7 days, try to manage your minor aches and pains without reaching for an NSAID. Use ice, use heat, use gentle stretching, and focus on hydration. See how your body feels. You might notice that your blood pressure drops a few points. You might notice that you don't feel as puffy in your hands and feet. This is your heart saying thank you. It's a small experiment that could lead to a lifelong change in your health. Always remember that your doctor is your partner, but you are the boss of your own body. If your doctor suggests a daily anti-inflammatory, ask them about the cardiac profile. If they aren't willing to discuss the long-term effects on your heart muscle and blood pressure, it might be time to get a second opinion from a cardiologist. We specialize in the longevity of the pump, and we want to see you stay out of the operating room for as long as possible. The medical community is slowly starting to recognize the scale of this problem. New studies are coming out every year that reinforce the link between chronic NSAID use and heart failure in older populations. We are learning that the standard of care from 20 years ago needs to be updated. We have better tools now, and better understanding of the aging process. We know that aging isn't a disease, but it is a change in state that requires a change in strategy. Think about the legacy you want to leave. You want to be there for the graduations, the weddings, and the quiet moments with your family. Staying heart healthy is the best gift you can give to the people who love you. It's not just about you, it's about being present for them. Every decision you make at the pharmacy or the grocery store is a vote for your future self. Vote for the version of you that has a strong, elastic, and vibrant heart. In the operating room, I see the incredible beauty of the human heart. It is a masterpiece of biological engineering. It can adapt, it can heal, and it can endure so much. But everything has a limit. Don't push your heart to its limit by using medications that work against its natural rhythm and pressure. Be the guardian of your own health. Be the advocate for your own longevity. I hope this information has given you plenty to think about. It's my goal to help you stay healthy enough that you never have to see the inside of my surgical suite. Knowledge is the most powerful medicine we have. Once you understand the why, the how becomes much easier. You have the power to protect your heart, starting with the very next time you feel a little ache or pain. Take a deep breath and feel your heart beating in your chest right now. It's doing its best for you. It never asks for a day off. It never goes on strike. All it asks is for a clean environment and a little bit of help. Give it that help by choosing heart-safe alternatives for your pain. Your future self will be so glad you did. We are living in an era where we can live longer and more active lives than any generation before us. But we have to be smarter than previous generations about the chemicals we put into our bodies. We have to look past the marketing and the convenience and look at the actual science of longevity. Protect your heart, monitor your pressure, and be very, very careful about every pill you swallow. I want to thank you for spending this time with me today. It's a privilege for me to share these warnings and tips with you. Your health is your greatest wealth, and your heart is the vault that keeps it safe. Keep that vault strong, keep it secure, and keep it healthy. I look forward to hearing about your journey toward a more heart-conscious way of living. Stay active, stay informed, and most importantly, stay heart healthy. You have so much more life to live, and I want you to live every second of it with a strong and steady beat inside your chest. See you in the next one, where we'll continue to explore how to keep your body running like the masterpiece it truly is. Until then, take care of yourself, and take care of your heart. It's the only one you've got, and it's counting on you.